There are a couple ways I like to treat plantar fasciitis. The first is to use those flat dome-shaped cups called energy cups from Lure Essentials. I call them the flip-flop cups. Because again, to put the cups on, you're going to flip them inside out and then back over. So we're going to take the first cup and we're going to flip it inside out. We've already done our palpation and we've received an ouch sign from our client. We poked on one area and she said, yes, ow, that's exactly where my pain is. So we're going to take that cup that we flipped inside out and we're going to put it over that area. So we're going to pretend like her ouch sign is here in her forefoot. So I'm going to take our energy cup. We've already put our lubrication on the foot. Sometimes the feet can be a little bit tricky to cup. If you are having trouble, you put a cup on and it falls off. Try cream, try lotion, try oil, and don't be afraid to use a good bit of that lubrication. Lubrication is like the glue that's going to make the cup stick. So we already put our lubrication on. I like a cream. I like a thick cream, particularly for the bottom of the feet. We have our cup flipped inside out. We're going to take that dome, put it over our intended area of treatment, and then we're going to flatten out the edges so that the cup sticks. So we're just pressing down on the edges. And we have our first cup on her foot. I'm about a size 9, so I can get about 3 of these cups on my feet. Our model has slightly smaller feet, so we're going to put a second one maybe on the next portion of our foot. So I'm going to flip the cup inside out again. Dome shape is going over the next intended area of treatment. Making sure that you give yourself enough space so that we're not right on top of that next on the first cup. Because if we try to put the cup on now and it touches the other cup, it's just going to fall off. So we're going to slide up a little bit. That way when we flip the cup back outside in, the edges stay on the foot. So we're going to go about right there, which is a great spot for plantar fasciitis pain, honestly. That medial band usually gets really, really tight and painful. And then we're going to flip the edges, press the edges out so that we flip the cup back outside in. From here, if we wanted to, we could stretch the foot. We can stretch the plantar fascia. So in order to stretch the fascia, we're going to dorsiflex the foot. And then we're going to gently pull on those toes so we can get like a bowstring stretch going on the bottom of the foot while the cups are on. These cups are great for treatments on the bottom of the foot because this area does not have a lot of soft tissue bulk. And the way these cups are designed, it's perfect for really grasping those not super bulky areas. So we can leave the cups on statically and let the cups work their magic while we go treat somewhere else. If her calves are tight, we can go and treat her calves. We can treat her hamstrings. We can treat the other foot while those cups stay on statically and work their magic. So as I was demonstrating the dorsiflexion and the stretching of the toes before, you can hold here for as long as you typically hold a stretch. My times kind of vary depending on what I'm going for, but a good 15 seconds or so, letting off, so stretching it and then letting off, giving that foot a bit of a break, the plantar fascia a break, and then going right back into that dorsiflexion stretch with the toes extended for another 15 seconds or so. I go back and forth between those and I'll do about 5 reps or so. If the feet are really, really tight and they are loving the stretch, you can hold longer or even do more reps. So this time, after the energy cups are applied to the bottom of the feet, just like we did the dorsiflexion and the plantar fascia stretch, we're going to take that stretch a little bit further this time. And again, I always talk about more bang for your buck. So this time we're going to do what's called a knee lean. So we have our energy cups already on the foot. This time, in order to dorsiflex the foot and the ankle, we're going to take our thigh and we're going to put our thigh right into her foot so that it dorsiflexes her foot. So if we lean into it, there's a dorsiflexion. If we come out of it, the foot kind of goes back into a resting plantar flexion position. So again, I'm going to take my thigh, I'm going to take my knee, and I'm going to lean into the cups and lean into her foot We are going to dorsiflex that ankle, that foot, as far as we can. I'm going to drop down in a bit of a lunge, and I'm going to sink my knee into her toes so that I can also get a stretch at her toes to stretch that fascia. Again, strategic, specific. We have 60 minutes. We're getting a good stretch through that calf. We're getting a good stretch through her plantar fascia. I have 2 hands that are free. I just so happen to have 2 edge cups too. So I'm going to take my edge cup, I'm going to use a pinch grip method, and I'm going to drive that cup around her gastroc muscle because likely it has adhesions or tightness. So now we have gone from stretching the calf, stretching the plantar fascia, and now we can iron out adhesions all at the same time. We can go back to our oval shape and we can kind of iron around the ankle. We can get into the Achilles tendon. We can get into the muscle bulk of that gastroc muscle. We can park the cup if we find an adhesion that, again, is sticking its tongue out at us. We can leave that cup there for some extra TLC. I can take another cup and I can do the same thing. I can drive around that gastroc. If my reach is long enough, I can address the hamstrings at the same time. I can address the left side. I can address the right side. Whatever you did during assessment, you have that mental list of tissue issues. Take that time now to go ahead and knock some of those things off your list. Again, strategic, specific, more bang for your buck. Knock out all of the things on your list so that once they get off the table, they are feeling really, really good and you have that long-lasting result that we talked about before. Another great way to treat plantar fasciitis pain and adhesions is to simply drive over or vacuum out the adhesions. For this technique, you're going to use an edge cup. I like the smallest edge cup because the foot is only so big, so we want to make sure we select a cup that can go on the foot and then still have some room for movement. So for this one, we're using the edge cup, and you either have your client in supine or in prone. For this particular technique, I prefer my client be in prone. This way I just get a better leverage and I can do other things while she's in prone. So we are going to do what's called the ovaling technique with the cup. And that is maintaining the cup in an oval shape by first attaching the cup to the foot with the pinch grip technique. Once the cup is attached to the foot using that pinch grip technique, we're going to maintain the cup in an oval shape by continuing to pinch the sides of the cup. Not enough to break the seal of the cup, but enough to keep the cup in a narrow oval shape. While the cup is in the oval shape, we're going to drive the cup around the foot anywhere where we find adhesions or tightness. If for some reason the suction breaks, reapply. Pinch grip again. Put the cup on the foot. Go right back into your oval shape and drive that cup around. It's easier if you do shorter strokes as opposed to attempting to go from origin to insertion or insertion to origin. Small strokes that resemble friction really work well. I like to go at a slower pace. The faster you work, usually the cups tend to break suction. So stay within a small plane, but you can transition that ovaling technique into more of a doorknob technique if that works well. So for the doorknob technique, you're going to take your cup and literally turn your doorknob. So you're going to turn the cup and advance the cup wherever you'd like it to go. For that technique, again, I use the pinch grip method. That's what I like. That's what works best for me. So we're going to do a pinch grip, put that cup on the foot, and then we are going to turn the doorknob slowly, and we're going to advance that cup around the foot, around those tight adhesions and areas of pain. For someone that has really, really tight fascia, pain in the feet, this is going to feel amazing. We can take it a step further. We can dorsiflex that foot again. That way we're getting a stretch through the gastroc. We can kind of tug on those toes and get that stretch of the plantar fascia. And we can doorknob all at the same time. This way again, your treatment is specific, it's strategic, and you're getting a lot more bang for your buck, and you're using your time just a lot more efficiently. While our client is here, we want to address each and every adhesion, every tissue issue that we put on our mental list. That way, once they get off our table, they are feeling wonderful. We have improved their quality of life, and we've taken care of all their pains.